Culture is a big and diverse word in the English language that has now gone just beyond racial, ethnic, and religious groups. Now, organizations have their own culture, and even within certain locations and certain friend groups and many other different factors, cultures play a huge part. Culture is also something that's very fundamental to how we communicate on a daily basis with everybody. And it's particularly evident when we are speaking to a diverse group of patients. Now, there are a lot of elements, facets, and nuances that go into communicative well and effectively amongst different cultures. So we're going to look at that more into this video. So for that, please stay tuned. Welcome back everyone to my channel. It's been a while since I have seen you all, and very glad that you joined me for this. Now, as you can see, my setup here is a little bit more different, although I feel that I should have done this recording during daylight. But yes, I should say we, have officially moved into our new bigger place. And that is what took up all of our time last week, where everything was done, dusted, and finalized. And I'm extremely pleased that now I have a proper study room all to myself, and also like a studio space. So I have the privacy and peace and quiet from where I can deliver these videos and many of my other content that you will show. But obviously I'm not going to be filming just from this part of the place. I'll be doing it from different parts of where I live, just for a bit of variety and just to keep things a bit more exciting. Now, by the way, for those who don't know me, my name is Shweta. I'm the founder of Healthy Dynamics. We are a coaching practice that helps English healthcare providers whose English is not their first language become better, more empathetic, compassionate, articulate, and authentic communicators, for them to build better relationships with their patients, follow their practice with much more influence and impact in an organic manner, and also get more referrals and build credibility and trust and become excellent at their jobs. So like I mentioned in the very beginning of this video, I spoke a little bit about the role of culture and what is its importance when we are communicating with our patients. Now, if you recall from last year, I have done about 2 or 3 more videos on what to do when you're speaking to patients with patients from different cultures and all that, and looked at different elements of what is it that contributes to cultural diversity. So I'm going to leave a link to that playlist over here, and I'm also going to leave in the very end of the video, in the end screen, one of those videos which might be quite informative and useful for you, just to get a bit of context on what exactly I'm talking about. In case you missed those videos, please go back and check them out. So culture plays a huge part, obviously, in communication, and in particular in healthcare. We no longer live in a world that is completely homogeneous throughout. Like, even in the most insular and more close-knit communities and societies, we do see people from different skin colors, different religions, different ethnic backgrounds, different languages, different sexualities, different the neurodivergent spectrum. So, but here specifically, I'm going to talk about culture amongst in the context of ethnic groups. So there are plenty of videos that I've done on neurodivergence and all the other points that I've mentioned here. So go back and check those out on my channel. So what I wanted to really focus on is the importance of cultural competence, and I've covered that in one of my past videos as well. But what I wanted to really focus on in this video was really to look into why cultural competence, or where it actually shows up in communication. So cultural diversity, cultural differences, and being us as healthcare providers really needing to be culturally competent. So I'm going to break it down into 3 or 4 different elements, and in what ways can we expect cultural diversity to show up amongst our audience and amongst our patients. And then obviously this would hopefully give you the foundation on how you as healthcare providers can become not only more culturally sensitive and aware, but also much more competent in order to get a better understanding of the fundamental cultural, religious, ethnic, and language diversities that they have in their patient cohort. So let's get cracking on this. One of the main ways in which cultural diversity will show up amongst our patients is the application of low context, or rather I should say high context and low context communication. So there's a big difference between the two of them. So high context communication is where you don't generally get straight to the point. And you also don't, people from those backgrounds, they will generally not be as forthright or direct or speak their mind or say or ask for what they want and really, really speak up for themselves or really set boundaries. And while that may also be a problem of them not being assertive enough, for them, really getting to the point of something will take a very, very long time. Whereas low context cultures, like the one that I come from, which is Australia, is the exact opposite. You just cut the fat and you get just straight directly to the point. Now, for someone like me, because I'm really, I call myself a third culture kid because, I've come from the childhood that I had in India, then I lived in Australia for 22 years, and then, I've spent my time traveling to so many parts of the world and lived as an expatriate. I have witnessed and experienced this firsthand in many, many instances. Now, in case you don't know this about me, and I have mentioned this in some of my LinkedIn posts, I'm an extremely, extremely direct person, and I have always been like that. Even as a child, I used to really tell it like it is. I would never mince my words. I would never tell people what they wanted to hear. Whether it was good or bad, I would just say what was on my mind. I had no filter. I did not ever care about how it's going to come across as other people. This continued into adulthood, and obviously, people had a lot of problem with which I communicated because I was so direct. And this was particularly evident just a few years ago when I was working as an ESL teacher with Japanese students. Now, Japan is an example of a culture that is very, very high context. So for them, they tend to be overly polite, they tend to be overly courteous, and offending somebody or themselves can be really not only frowned upon, but also can be seen as your losing face. So when they perceived my feedback, or during our lessons, when I would give them feedback on something, or when I would encourage them to or support them in coming up with answers, or push themselves to do something in the space of our time that we were working together, I got a lot of criticism for how direct and abrupt I was with them. And whereas in other cultures, like say when I worked with the Germans and the Europeans and even the South Americans, this quality of mine was really, really well favored. They absolutely wanted that honest feedback. They wanted that directness. They wanted me to be blunt and abrupt and tell it like it is. And that's how they operate as well in the world. But now the thing is, there is no direct way of knowing that, whether someone is low context or high context, because, even though I come from a high context culture like India, I'm the exact opposite. So there's no way of actually knowing it. So sometimes it does become a little bit of a trial and error. So you just have to sort of be equipped to know that different people will need to be communicated to and delivered information in different ways, which sort of goes well into my next point is people perceive and absorb and really comprehend information in different manners based on different cultures. Now, let's sort of say, for example, you are an endocrinologist, and you're say working with a patient, a woman who has polycystic ovarian syndrome, who's just been diagnosed with that. Now, I had this challenge in my 20s, and say, for example, that particular person or that patient is someone from a country that is really, it's very much family orientated, and, she herself wants to have children, and that's just the be all and end all. Now, something like polycystic ovarian, besides all of the other problems that it brings, it also really impacts your fertility in a negative way if you're a woman. Now, if you are aware of the fact that she comes from a culture where you know for a fact that she may 100% want to have children, and also that is what is expected of her because it's a family-oriented culture, you have to be able to break that information or that bad news, challenging news down in a much more gentle manner. So you cannot say directly that you should not really go into that conversation directly and say, hey, listen, you have polycystic ovarian. Now, in some cultures, like for me, when I was told that, I was extremely happy that, because I could, it made sense to me that, this is why the endocrinologist who gave me the information, this is why I'm showing these symptoms and this is the implications on me. And I was very relieved that I have that diagnosis, and I was very grateful that he gave me a very, very clear answer with no smoke and mirrors. Whereas with a patient who's like that, you have to really break it into them gently. So you have to first go into, what the results showed, and then, what could be the consequences in the future on her health. So the things that polycystic ovarian influences is your hormone levels, you're much more prone to gaining weight, having, facial hair, becoming diabetic. So you have to really chunk all this information down and do it in such a way that it's not going to hit them in such a shocking and somewhat of a disappointing manner immediately. And you also have to be sensitive to the fact that she probably most definitely wants to have children. So I've just given you an example of how someone perceives from a different culture, perceives information in a certain way, and likes to be received, to get information in a certain way. Whereas in some cultures, like the one I come from in Australia, or even other parts of the world, you just have to hit them on the head with it and say, listen, this is the situation. Our tests have shown that you have polycystic ovarian, plain and simple. For me, that worked out really well. So, no complaints. And because I don't want to have kids, it was a blessing in disguise. So I was very, very grateful to have found those answers. And also my endocrinologist at the time giving it to me very, very directly without going about it in a roundabout way. So that's number 2. Number 3, a big one, is also the fact that how in different cultures, how healthcare providers are obviously, and the relationship between healthcare providers and patients is different in different cultures, how they are perceived. Now, say for example, in countries such as America, UK, Australia, and all that, you will see, and this is by no means offending somebody, it's just the way it is. Healthcare providers are, even though I absolutely admire the work that they do, some of the work that they do with patients, I certainly couldn't do it. So, but a lot of people in these countries, they perceive healthcare providers as public servants who just have to be at their beck and call, get everything done for them. And so in some ways, they're not treated in a very nice way in certain parts of the world. Whereas in countries such as the Southern Asian part of the world or the Southeast Asian part of the world, healthcare providers are really worshipped, because they are seen as an authority figure, and because their culture and their society is much more hierarchical. It's very common for them to really literally worship the ground that you walk on as a healthcare provider. Compared to, say, if you're working in a country like where I live, or say in the USA or UK or Canada, where the perception is very, very different. So all of this really plays into how you should communicate with your patients, what kind of boundaries you need to set, what kind of expectations that you need to set with them. And all these things in combination go into why, in different cultures, you have to communicate, you have to fine-tune your communication based on the cultural background that the particular patient is coming from. Now, cultural competence, awareness, and sensitivity is one of the most fundamental things that I cover in my coaching program, my standalone coaching program, where it looks into all of this and many, many other facets of, the importance of cultural competence, and why it's such a must required in this day and age in healthcare. So if you feel that this is an area where you can really improve on, or you need a bit more support in, and amongst everything else, my coaching program will be live by next month. So if you feel that you may need some bit of support and help in this one, go to my Calendly link, which I'm going to leave here, and book a 30-minute strategy session with me so that I can get better understanding of where your challenges are in this space and several others, and how I can best support you. And always don't forget to like, subscribe, and hit the notification bell to stay more updated on my weekly videos. Until next time, thank you very much for your engagement, time, attention, and presence, and see you next week.